Well, back here at home and really across the country, but there is a new push tonight for transparency from United Healthcare, which is based here. A group of shareholders in the company is now asking the board of directors to prepare a report on the impacts the company's denials for care are having on public health. The proposal specifically calls for a closer look at the risks created by the company's practices that limit or delay care for patients. Gordon Severson has been digging into that proposal and joins us with details. Gordon?
Yeah, these investors say their concerns did not start with the murder of CEO Brian Thompson, which is clearly tragic. The group that filed this request is called the Interfaith Center for Corporate Responsibility, and they represent more than 300 investment groups, including pension plans, fund managers, and various faith-based groups. And many of their members have shared some concerns about United Health and some of their business practices. A spokesperson for the group says they have had these concerns for years, but in recent months, their concerns have increased with the company being in the limelight recently after the tragic death of the company's CEO several weeks ago. These investors want to know more about how denying insurance coverage impacts these patients. If they're not covered, do they forego treatment altogether? Do they get more sick? And how is that affecting their quality of life? These investors are also worried that denying insurance coverage could hurt other companies and other sectors in the economy that rely on those workers.
At the end of the day, we want companies to be successful. We want companies to be able to make money. But we also recognize on the flip side that when you don't have a healthy workforce, right, companies can't produce the goods and services that they need to develop.
A spokesperson for United Health says the company will respond to any shareholder proposals in their next proxy statement. Their last proxy statement for 2024 came out in April, so this coming April is when we could see a more in-depth response from United Health regarding some of these concerns. Back to you.
All right. Thank you, Gordon.